name is Dr. Rick Seguil.
And action. Hey, Jay, this is Kirsten. And action. Hey everyone, it's Dr. Rick. And today's Minute Clinic is on cannabis for chemotherapy-induced nausea and vomiting, CINV. So those of you who are fighting cancer, whether it's early cancer and you're just going through some easy protocols, or it's advanced cancer, metastasis, I think there are some common things that you can take advantage of that your doctor probably won't know too much about. So we'll go through this pretty quick. The natural course are the natural things that help. I think that I've heard some cancer doctors saying just eat anything you want, assuming that the patient is just emaciated. But I don't think you should eat anything you want. I would not have alcohol. I would definitely try to lower the preservatives in your food. Dairy, I would not do. Those things that are heavy, I would not do. So I guess I shouldn't turn this into a food video, but knowing that ginger does help with nausea is important. Ginger works to move the stomach contents out. So the longer something sits in the stomach, the higher the potential for bringing it up. That's why I don't like dairy. It takes a long time to break down dairy in the stomach. So the longer something sits in your stomach, the higher the chances for you upchucking it. Ginger moves the contents of the stomach down into the small intestine. Once the stomach contents are dumped into the small intestine, usually they won't go back upward. But while they're in the stomach, they can easily go up into the esophagus and out. So ginger helps with that. If you cannot find ginger in tea form, then just cut up a ginger root, hopefully organic, about 1/8 of an inch, put it in your tea, and brew your tea as usual. I think I've done videos on tea. I'll see if I can put them down below. I like Gyokuru and Sencha. Are my favorite, and if you just put the ginger in there, it should brew up properly so you have the active ingredient of your ginger. That's one option. Those of you who have access to Whole Foods, you can actually get these things. These are homeopathic pellets, and you really should see a homeopathic doctor that's trained in figuring out a diagnosis and finding the exact homeopathy drug to help. But the pellets, low side effects. The ginger tea, low side effects. So the homeopathic pellets that specifically are used for nausea and vomiting are called Nux vomica. So if you take like a 30C, so if you take 3 to 5 little pellets, put them under your tongue or chew them up 3 to 5 times a day, that should help with nausea and vomiting. That's just a rough shot estimate on how to use homeopathic pellets. If you can find a homeopathic doctor or a naturopath, that would be good. Naturopathic doctors are very good with homeopathy. That's a doctor that's certified with not MD, but ND. So MD is what I have. That's medical doctorate. ND, especially from guys that are trained out of Bastyr, that's like the Harvard of naturopathic medicine. Naturopathic doctor. N as in Nancy, D as in David. So if you can find somebody, I'd say tap their brain. Keep them on your team. The other person to try to find, acupuncture. This is an acupuncture needle. So if you can find an acupuncturist that's close by to you and that's covered by your insurance, even better. So acupuncture is old school. If you can find an acupuncturist, sometimes going to the acupuncturist the day before your chemotherapy and then the day after will help calm down the energy that's flowing up. So without getting into too much of an energy discussion, just trusting that the acupuncturist will help knock down the side effects of chemotherapy with essentially no other side effects. So the homeopathic pellets, the ginger tea, the acupuncture, low side effects. So I'd say get those people on your team, in addition to your chemotherapy or oncology team. The other thing, if you can't find any of those and you're on your own, you can always just rely on, so Zofran is a great pill. Zofran is a melt-in-the-mouth pill. I've prescribed it for kids with gastroenteritis, pregnant women, and chemotherapy patients. But usually that's something that your oncologist will probably give you anyway. And there's several other ones that are older, like metoclopramide and prochlorperazine, but they're older and they have higher side effect profiles, so you have to be careful. What I wanted to talk about today is the use of cannabis. So the boomers that I have, and I'm the tail end of a boomer, We all know of cannabis as just recreational. You smoke it and you get high, but it's not illegal anymore. And number two, it's so cultivated that you can actually get the flower and boil down or extract out the exact active ingredients that you want in your body. So specifically with chemotherapy-induced nausea and vomiting, there are a couple of, so here's a couple of studies that you might want to access. This is from the British Journal of Medicine. I'll just fly through these because I want you to have some references. This is from US. This is also, these are smaller studies, so you can freeze and look up. These are all on PubMed. But essentially they talk about the great effects of cannabis to turn off chemotherapy-induced nausea and vomiting, and other things, obviously. So this is a bud that I showed in one of my previous videos. This is from a patient of mine, and from local dispensary. It's legal to have a card and medical cannabis. Specifically, if you have one of the, boy, that's really strong. If you have one of the diagnoses that are considered disabling in the state of Illinois, a doctor can get you certified for medical cannabis. The problem I see is that most of my colleagues that certify don't know what to suggest. So my patients wind up going to the dispensaries and just asking at the dispensaries. But nowadays, you can't even ask because a lot of dispensaries are drive-through. So you have to kind of do your own research while you're online ordering your products. Hopefully in 2021, maybe you'll be viewing this then, COVID will let up and we'll go back to shopping again at dispensaries. But here's the thing, at most of the dispensaries that I've seen, usually you get up to the front of the line, you ask the salesperson, also known as a bud tender, you ask the salesperson about, what should I get? I've heard this, I was listening. I don't actually ask that. I know what I'm getting because I researched it beforehand. And please, check out my other videos. So if this is the first time you're finding me, subscribe because I put these videos, every fourth video is about a cannabis, I believe, at this point. So I'll probably be putting all my cannabis videos into one lump area so you can always access them. But if you go to the dispensary and you ask, then I think you will get some common knowledge from the bud tender that you're talking to. And they'll probably, just by experience, know that certain people that are looking for cannabis for nausea there'll be a dominant strain that they always ask for. But this is a sales business, and sometimes people will be encouraged to tell you to buy whatever's backing up on inventory. So I mean, it's not illegal, but I think that you should be empowered to read on your own. Leafly.com is a good place to learn about Cannabis 101, or my videos and certain other videos that you might find online. And then reading Cannabis Index or Cannabis Pharmacy, they're both really thick books, but they give you some nice refreshing points. Or going on PubMed. Raphael Mechoulam out of Israel is the first man who came up, or the scientist who came up with the data from the endocannabinoid system. I think it was discovered in the 1980s, but it has really ramped up as far as its usefulness in medicinal problems, in diagnoses. So the millennium brings on a lot of different diseases all at the same time. And if you happen to be loaded with a diagnosis of cancer, I think this is useful. So as I was saying, if you use cannabis in its bulk form as a bud, then you'll be smoking and getting all the active ingredients in the bud that you buy into your system. So that's kind of good, but know that most cannabis that you smoke, if you have the specific active ingredient of THC, you'll probably take care of the nausea, but you'll probably be high. And you might have to weigh the decision on calming down nausea and being super high if you're going to be stuck on the couch or maybe paranoid. Probably not good, right? So that's why you have to be a good shopper. So if you're going to make a good dish, you have to know the recipe, you have to know the ingredients to the recipe, you have to know how to brew your dish. And just having one big flower might not be the way. If you can get access to a dispensary and look at their products, as you take the flower and you process it from flower to vape, to edible, to topical, to even tape. Yes, there's tape forms. You can get the specific components of the cannabis plant dialed into what you want. At this point in time, there are some cannabis lookalikes that the pharmacies have come up with, and there's three in particular. Nabiximols, which is also known as Sativex. There's also Marinol, Dronabinol that you can smoke, and then there's Nabilone, which is Sesamet. And Nabilone has been studied for its effects with nausea and vomiting. So cool. The only problem is I'm not sure if it'll be covered by your insurance, and I'm not sure of the price if it's not covered by insurance. But the cool thing is, because it is a prescription, now some of them are in Canada, but there's a couple that are available in the United States. If it's a prescription and it's on your formulary, you might be able to take advantage of it. So ask your doctor, especially if you're on a limited budget, maybe it'll be covered by your insurance. But from what I understand, Nabilone, which has been studied, and we need more data, but since it's Schedule 1, the places that put out the data, like Harvard, Stanford, MIT, the places that put out the data are limited because it's still Schedule 1. So if you're going to vote this November, 2020, please vote for somebody that's going to take it off Schedule 1 classification. I mean, you can get more data involved in research studies. But the data I showed you earlier essentially showed that in the meta-analyses, sativa is a strain of cannabis plant that can be useful for calming down nausea. And if you're just going in and you're not going to do any research and you're just going to ask for a strain, at least ask for sativa. But if you ask for sativa, there's like a whole laundry list of different sativa products. It'd be the first step if you're totally lost. And if you do try to smoke, I wouldn't smoke the bud. I'd probably choose to get the vape. And that's where this comes from. This is this. So the vape is an oil, and it's extracted from the bud. And you do have to smoke it, but you don't have the tar of the bud. So when you smoke this in joint form or bowl form, you do get the active ingredients, all of them, all 140 to 200 of them. But when you start to process it down into oil, you'll be able to decrease all the other ones you don't want and kind of focus on the active ingredients that you want. There's new data that's coming out that shows THCV is specific and can be useful for nausea and vomiting. But in the United States, it's hard to find cultivators that will label THCV on the ingredient label. But if you happen to find, if you're diligent enough and you can read all the little labels in the products that you check out, look for THCV. And that might be even more decisive to get a product that's specifically for nausea and vomiting. But until you can find that, unfortunately, you have to rely on your natural stuff and perhaps using a cannabis product of some sort the day before, the hours before chemotherapy, and then the day or two after chemotherapy would be helpful, at least on a 3-time-a-day basis. Tincture, edibles, they all are helpful, but it's very unpredictable when you eat something. It's unpredictable how fast it will work. So, and how long it will work. And certainly if you get nausea and vomiting taken care of, that's cool. But if you have nausea, vomiting, and being high, and it's going to last you 24 hours, it might not be good. So we're kind of fighting for just controlling the symptoms. And so that's the biggest side effect to this plant, is that you might be in the couch. In very rare populations, you can also have a little bit of paranoia, especially with inhaled versions. So you have to be careful. The three groups that are not supposed to take advantage of the cannabis plant are pregnant women. I think it will help with pregnancy, but at this point in time, we don't know about what happens with transferring the active ingredient through the placenta. Kids less than 18, because of the fact that it does change around neuroplasticity, so you have to be careful. And there's a higher cannabis use addictive value. And then people with schizophrenia in their gene pool. So sometimes these three you have to be cautious with. Now we have a lot of kids that have Lennox-Gastaut and Dravet syndrome, that's childhood epilepsy, that have taken advantage of CBD from hemp. And that's also, that's Epidiolex, that's produced in Canada, but they're finding that it helps with kids. CBD, there's no high with that one. So I think the data is rolling out, but it's still in its infancy, and until it gets to be non-Schedule 1, which you will. You'll make it through chemotherapy. And hopefully without too many speed bumps. If it ever comes back again, then you can get back into the use of this plant. But once you beat this crap, it's important to keep the chances for resurgence down, and that's where sleep would be important. Again, I think cannabis is great for inducing good sleep. I have a patient that's fighting breast cancer, and she sleeps, well, she's got a lot of medicines, but she sleeps from 11 to like 8:30, but then she takes greater than an hour nap. She sleeps all day because of the other medicine she's taking. Survivorship is lower when you don't get enough sleep. So even in the studies of breast cancer, I think it's very important to fight the nausea and vomiting from the current chemotherapy, but also extend that. Once you beat the cancer, you got to extend it in the use of healthy living even afterwards so that we can make it to 100 and not have this resurgence again. So hopefully this gives you a little bit of an idea what to rely on. Again, if you have no options, just smoke. But try to save your money. I always say that CBD is helpful for decreasing the side effects of the smoke. To end our discussion, there are components, as I mentioned, where you can actually just buy CBD. And I'll put the link down below of a previous video I did on CBD. If you load up with CBD 2 to 3 times a day in your system, that's you're not going to get high with that. But sometimes the load up of CBD a week to 4 weeks before your chemotherapy, when you do have to smoke, the CBD that's in your system will control the side effects of this smoke, which is cool. The CBD is the big brother of the THC. That's what's so beautiful with this plant. There's so many different things, CBD, THC, terpenes. There's so many different things in this plant that you can mix and match and get what you want out of this. And I really think this should be legalized to the point of non-Schedule 1. So vote properly. And if you have any comments on what you use to take care of your chemotherapy, especially the strains, there's a whole bunch of different ones, please put your strain down below that you've used to take care of chemotherapy. Otherwise, don't forget to subscribe, and I'll see you in the next video.